everyone. So in this video, we are going to see about infrahyoid muscle, its origin, insertion, nerve supply action, as well as about ansa cervicalis. So first, what do you mean by infrahyoid? So in the muscles of the neck, they are divided majorly into two groups. All the muscles above the hyoid bone and all the muscles below the hyoid bone. So in this infrahyoid group, it consists of four muscles. So what are the four muscles? We'll see them one by one. In order to know the four muscles, you have to know about some bones and some landmarks present in the bones. So we'll look at the bones first. What is this bone called as? It is the hyoid bone. Okay, so all the muscles that we will be seeing comes under this bone, okay, or below this line, okay, infrahyoid muscles. Next, we are going to see this bone. What is that? That is sternum, or the manubrium of sternum, and we are going to see a cartilage. This cartilage is called as thyroid cartilage. Thyroid cartilage. Now this thyroid cartilage has two lines like this. They are called as the oblique lines of thyroid cartilage, and the hyoid bone has a body. The central region is called as the body, and it has two horns. The smaller one is called as the lesser horn, and this bigger one here, the longer one here, is called as the greater horn. So this is the major thing that you have to know before moving on to the attachments of infrahyoid muscles. So first, regarding the first muscle of the group, that is the thyrohyoid. Can you guess its origin and insertion? Origin is in the pink shade and insertion is in the blue one. So let's see what it is. First, this is the origin of the muscle. It originates from the oblique line of thyroid cartilage, and insertion, it inserts into a part of the hyoid bone. What is that? It is the greater horn. Okay, greater horn, and this is the oblique line of thyroid cartilage. Origin is from thyroid cartilage and insertion is into the hyoid bone. And what about its? So this is how it will look. Okay, so this is the thyrohyoid. It connects thyroid cartilage and the hyoid bone. You have to know where in thyroid cartilage, which is the oblique line, and which part of hyoid bone, which is the greater horn. The nerve supply to this is provided by the C1 branch. Okay, so the nerve is by the C1 through the hypoglossal nerve. And action in general for all the infrahyoid muscles, just see which is the upper bone. It always depresses the upper attachment. So here, which is the upper bone? The hyoid bone. So that's the upper one. So it depresses the hyoid bone. That is the function of thyrohyoid. Now let's move on to the second muscle, that is sternothyroid. Now what is the origin and insertion? Origin is here in this part. Okay, and this is the insertion. So origin is from the posterior aspect of manubrium of sternum, and the adjacent part of, you can see, this is the first strip. Okay, this is the first strip. So the posterior aspect of manubrium as well as adjacent part of the first strip. This is the origin, okay, from sternum. And what about the insertion into the oblique line? Okay, insertion is into the oblique line. So sternothyroid should connect the sternum bone and thyroid cartilage. Origin is from sternum, to be specific, posterior aspect of manubrium, and insertion is into the oblique line of thyroid cartilage. Just to see which level of manubrium you are corresponding it to the bone that is present laterally. Okay, you'll understand this better once we see the next bone. Okay, so this is how the sternothyroid is. What is its nerve supply and action? Nerve supply is from ansa cervicalis corresponding to C1 and C3, C1 to C3. Okay, we'll see what ansa cervicalis towards the end of this topic. So this is the sternothyroid. So what all muscles we saw? The first muscle connected the thyroid cartilage and hyoid bone, which is thyrohyoid. The second muscle is called as sternothyroid. The third muscle is called as sternohyoid. Now, what is its origin? this one is also arising from the posterior aspect of manubrium of sternum, okay, and the adjacent part of the clavicle. Okay, so can you guess which is the higher one and which is the lower one? Sternohyoid arises more superiorly when compared to sternothyroid. That arises from here. Okay, this part of manubrium and the adjacent part of the first strip. So this is how you have to remember the origin of sternohyoid and sternothyroid. What about its insertion? It inserts in the lower border of hyoid bone medially. Okay, remember this one inserts medially in the lower border. So this is the midline. Okay, and sternohyoid inserts medially. So how does it look? Like this. Okay, origin is from sternum. Okay, at a most superior level when compared to sternothyroid, and insertion into the lower aspect of body of hyoid bone medially. Now why we have to remember medially is because of the next muscle which attaches laterally. So what about its nerve supply? Is once again from C1 to C3. Okay, the nerve supply is from C1 to C3 through ansa cervicalis, and its action, it is attaching to the hyoid bone, so it will depress the hyoid. The previous one, sternothyroid, it will depress the thyroid cartilage. Okay, so that is the nerve supply and action. So what all muscles we've seen so far? The first muscle connected the thyroid cartilage and hyoid bone, that is thyrohyoid. The second one connected sternum and thyroid cartilage, that is sternothyroid. Both of this muscle, the thyrohyoid and sternothyroid, they both are present at a deeper plane. Okay, superficial to both of this muscle is the next muscle that we saw, that is sternohyoid. Now we'll move on to the fourth muscle or the last muscle of this group. Okay, it is called as omohyoid. Now for this you have to know about another bone also. What is this bone? It is present in the shoulder. It is called as scapula. Okay, that forms the shoulder blade. It is called as scapula. Now you have to remember it has three borders. This is the superior border, medial border and lateral border. Okay, so the origin of omohyoid, the inferior belly is from superior border close to a notch. What is this notch called as? It is called as suprascapular notch. Okay, so the origin of inferior belly of omohyoid is from superior border of scapula close to the suprascapular notch. Okay, so that is the origin. This green shaded area is the origin. Now we'll see what it happens to the muscle. It will insert, the inferior belly will insert into a intermediate tendon, which we will be seeing. Now what about the superior belly? That will originate from the intermediate tendon and it will go on and insert into the lower border more laterally. This one, okay, more laterally. So this is the insertion of sternohyoid. This is the insertion of omohyoid, and along the greater horn is the insertion of thyrohyoid. Okay, so this is, you have to remember it regarding the infrahyoid group. Now, this is how the muscle will appear. We saw no inferior and superior belly. This is the intermediate tendon. Okay, intermediate tendon. Now this will connect both the bellies. What are the bellies? Superior and inferior belly. Superior and inferior bellies. Now you can't see the origin here in this region because it goes more posteriorly into the which bone? Scapula, the superior border of scapula close to the suprascapular notch. So we've seen the origin and insertion of this muscle. What about its nerve supply? Once again it is from C1 to C3 through the ansa cervicalis. And what about its action? It is attaching to which bone? Hyoid. So this one also will depress the hyoid bone. So except for only one muscle, the sternothyroid, that will depress the thyroid cartilage, all the other three muscles will depress the hyoid bone. Now we've seen about origin, insertion and nerve supply and action of four muscles. What are the four muscles? It all started with thyrohyoid. Okay, so we'll take a look at what the four muscles are. Okay, the first muscle that we saw was thyrohyoid. The second muscle that we saw was sternothyroid. It originated at a more inferior aspect when compared to the next muscle, that is sternohyoid. Okay, these are the three muscles, and the fourth muscle is omohyoid. Okay, that will insert more laterally when compared to the sternohyoid. You can see sternohyoid is medial and omohyoid is lateral, whereas thyrohyoid is present in the greater horn. So this is the origin, insertion of all the infrahyoid muscles. In the next part of this video, we will see what ansa cervicalis is.